thumb in between the 4th and 5th metacarpal, and I control with my fingers their thenar and their wrist, so I have external rotation. It's just a nice grip on their hand. With my thumb down, that's when I go after pec minor and major. I'll squeeze that. If I want to get those pec minor fibers that are inserting on the rib cage, that's where I'll bring the arm up a little bit, take my knuckle, and kind of push down so I'm like so, nudging down into 3rd, 4th, and 5th ribs. And then as I come back to neutral, I'll use my thumb or thenar or hypothenar and kind of hook up into the coracoid process to get that pec minor going into the top of the coracoid process. After I've hit pec minor, maybe I'll check major too, and I can even press into major that way as well, into like the sternum and the upper clavicle. And then I switch hands, so now I'm holding with this hand. I squeeze their trap, or their tricep, and then I duckbill squeeze the bicep. If anything jumps out to me, if they feel extra tender or anything like that, or the patient comes in complaining of arm complaints, and that's what we're assessing and treating, then I'll go after more insertions, like I'll go after that radius insertion, maybe brachialis I'll start tuning into, but it's just a general flow. I'll just kind of squeeze it, check, if something jumps out of me, it jumps out of me. Then I do that vice grip contact we talked about, the forearm, and walk my way down their forearm, noting of anything that jumps out at me. Open up the wrist joint, traction the fingers, and then I go back, and anything that jumped out to me in the forearm, now I'm going to treat that. So I felt some flexor stuff on the inside, so I'm pushing up into that common flexor insertion, treating in through here. Felt a little bit of pronator teres, so I'm pushing up into the origin of that. Bring my thumb down, hooking into the top of the radius and pushing into that. I also felt some extensor stuff, so I'm going to switch and get pressure up into that common extensor tendon and treat some of that. And then squeeze down one more time just to see if that created change. In this case it did. Hand feels nice and soft now, or the forearm feels nice and soft, so I don't have to worry about doing it anymore. I would be much more specific with a patient that had wrist complaints if, like with muscle testing, range of motion, all that stuff, right? We would have been doing all of that. And I probably would have started with that. This is just kind of more of a wellness visit flow. Coracoid process, lifting up into it, pec minor. I can also feel the pec major, almost like a guitar string looking into the side of the humerus. Squeeze tricep. Squeeze bicep. Notice some extra spicy stuff in the bicep. I'm gonna work on some of those insertion points real quick of that. Squeeze down the forearm. Same thing, feeling some extensor stuff, so I'm pushing up into that extensor insertion. Feel a little bit of stuff on the front, so we're just gonna work some of those common flexor tendon points that I'm feeling. Work my way down, open the wrist, traction the finger, traction, 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 and then we're good. Okay, so things that I skipped, but depending on the patient.